Hi and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Since National Center for Alternative Medicine and Complementary Medicine has been established within the NIH, National Institute of Health, in 1999, acupuncture has been the most utilized alternative medicine. And today we have with us licensed acupuncturist Laura Shahinian-Kara to give us more information about acupuncture and its uses. Welcome to our program.
Thank you.
Laura, that you're a licensed acupuncturist.
Yes.
Before we go into what acupuncture does, can you tell us what kind of training you have to go through to become a licensed acupuncturist?
Yes. A licensed acupuncturist goes through at least 3 to 4, sometimes 5 years of training. The acupuncture itself is a 3-year master's degree program, and then you sit for the boards and you become licensed in the state that you were testing for. And often licensed acupuncturists also take a national board certification with the NCCAOM, the National Commission of Acupuncture and Oriental Medicine.
While you're going through the schooling, where is the practicing happening? Where do you practice actually as training?
Yes, good question. Every schooling is a little bit different. Keep in mind there are many different styles of acupuncture. The college that I went to in New York City had us practicing from the first semester of school on, because you have to get very good at the technique of needling, because you can actually puncture lungs.
I know there are different techniques in acupuncture. What kind of technique you were trained?
I was trained in 3 different styles of acupuncture. The one you most commonly hear about is traditional Chinese medicine.
Right.
I also trained with Japanese-style acupuncture, specifically the work of Kiko Matsumoto. And in Japan, that's a school for the blind. So it's very palpation-based, hands-on diagnosis. And then the director of our school, college, Dr. Mark Seam, comes from physical medicine. So it's very much based in trigger point needling and very Western-oriented classical
it's
style.
covered all 3 bases.
It is covering
Chinese base,
yes,
Japanese base touching, and then the physical therapy base.
Yes, and there's actually many more styles than that even.
Right. So do you choose different technique on different patients?
I specialize in Japanese acupuncture and Western orthopedics, so I combine the 2 of them, very hands-on work. So I will look at somebody's posture and kind of do a postural assessment, then I'll do more of a Chinese medicine assessment, and I will also do needling according to their problem, according to their person.
Right.
Some people can handle more than others.
Let's go a little detail into that needling. It's like with the meridians and the key rest.
Yes.
Let's explain that to our audience.
Sure. Well, acupuncture is based on an ancient Chinese medicine principle based on the meridian system, which is a little bit abstract to the Western mind. So I'll explain it in scientific terms, because it's actually very scientific. Many people think that it's this mysterious healing art, but actually it's really based on science. The connective tissue is where we put the needles into the tissue and the muscles. The connective tissue covers everything in the body, from muscles to organs to blood vessels and even nerves. So we find areas on the body, the areas have been mapped out where these nerve bundles are in the periphery, and when we put a needle in, or a strategic amount of needles along that channel.
These are disposable needles?
Of course, absolutely good question. Always disposable needles. Nobody autoclaves needles
made
anymore.
Of platinum or made of?
They're actually made of stainless steel, and they're solid, and they're hair thin, like a cat whisker. So it's rarely painful to have acupuncture done. It's not like a hypodermic needle or a big shot.
Right. Let's go talk about a little bit of complication can happen. Let's say if it's in inexperienced hand or in the beginning.
Yeah.
What kind of complication? Like you said a little while ago, can be some puncturing of the lungs.
That's right.
Yes.
I'm really glad you asked that question, because right now there's a big national movement for licensed acupuncturists to stop physical therapists and chiropractors from doing what's called dry needling. And dry needling is basically a term that's been renamed from trigger point manual needling, which was one of the techniques that I learned in acupuncture school. And they can do this class of needling in a weekend in less than 50 hours, sometimes in some states less than 25 hours.
So really there is almost no training.
There's really no training. And they have so much training in physical medicine, but they should not be using needles. They shouldn't be puncturing skin, in other words. There's a lot that goes into that training. One of the side effects can be they accidentally puncture a lung. Sometimes even up here in the upper trapezius muscles, if you want to release that, you have to be so careful because the lung can come right here.
Right. The tip of the lung actually is right there.
Exactly. So we are trained from day one really how to avoid these situations. Not that...
And it can be local cellulitis, right, from the needle sometimes?
Yes, absolutely. Right. So you have to know who and how to needle if somebody's, had cancer and had lymph nodes removed. We can't needle that side of that limb. And, so we have to really know the training and making sure that when you find an acupuncturist, they have the letters LAC after their name, licensed acupuncturist.
Let's go the conditions the most commonly that probably treated with acupuncture. Let's say, like I know one, post-chemotherapy nausea and vomiting.
Sure.
Post-operative nausea and vomiting. Maybe some headache.
Yes.
Let's talk about nausea and vomiting, post-operative and post-chemotherapy.
Sure. Well, I will often treat someone while they're going through chemotherapy for the nausea side effects, and then post-chemotherapy for the peripheral neuropathy, because acupuncture really works on the central nervous system, the peripheral nervous system, helping everything flow, getting more blood flow to the extremities, and it can really curtail the side effects of chemotherapy and nausea and vomiting from pregnancy as well. And it's interesting because the points are sometimes different and sometimes the same for both of those.
Okay. How about very common one? Let's say migraine headache or unusual headache.
Right.
That is the, so somebody came to you and had an MRI, there's no brain tumor or anything in that nature,
Right.
and they have this headache either related to the period or migraine or unusual
Right.
headache.
Well, it's interesting because in Chinese medicine, because we see the body as a whole and each person is an individual, we might treat the same headache in 5 different people, 5 different ways.
So how do you differentiate people? Which one are you going to use? Which technique?
We do that through a differential diagnosis, through questioning, through feeling what we call the pulses in Chinese medicine, which we can feel different meridian systems going through there. Through questioning, somebody's migraine headache might be from trapped muscles leading to the blood flow to the head. Others are hormone, as you mentioned, premenstrual, in which case we'll be doing a lot of points for balancing hormones. Some people with aura headaches, we have to figure out where that's coming from, where on the head it hurts. If it's the side of the heads, we often look at what's going on with the digestion with liver, gallbladder channels, and
how do you look that?
We palpate.
That?
The style that I do is I palpate, and abdominal palpation, known as the hara in Japanese, is very strategically mapped out to tell us what's going on with the meridian system. It doesn't necessarily mean there's anything wrong with someone's liver or gallbladder. It's the connective tissue channels leading to those organs themselves. So if somebody has a lot of side headaches or chronic headaches after they eat something, for example.
So that comes with the questioning.
Exactly, exactly.
Okay, that helps really that, this might be the abdominal source of it all.
Right.
Yes.
So digestion and the head we see very much corresponding to each other.
So what is the percentage of success? Now, most of the time they say, well, it's placebo effect. Sometimes it could be a little tiny bit more than placebo effect.
Right.
In your practice, what's your success rate? Or in general, I should say, first and then your practice.
Well, first I'll talk about the placebo effect, because I know there's been a lot of people say that acupuncture is just the placebo effect. But if you look at animals and the fact that acupuncture is often done on racehorses and animals, and in fact, my dog's vet is an acupuncturist trained in China. And so I've seen how my dog has healed from acupuncture And she doesn't know the placebo effect. So
What did your dog have?
my dog actually tore a tendon while she was running after a coyote in our backyard, because we live in the woods. And she was lame, and I took her in, and he needled the areas between her paw and up into the shoulder, and then some brain points apparently and she walked out of there and jumped in the car, no problem.
So she had a tendon rupture?
I don't know what she had exactly, but he treated. I don't think it was ruptured, because I don't think the acupuncture would work for a rupture. But it was definitely a sprain and strain, and within minutes she was fine,
she was
right
fine.
after the acupuncture.
Let's talk about then back pain.
Yes.
Very common, and some people go to acupuncture. And what do you do for back pain?
Back pain is so different for everybody, so it depends. Usually what I do is I do a couple of orthopedic tests to see, is it a disc on a nerve, some of the straight leg tests and slump tests, or I'll just kind of see where their hips are aligned and look at the muscles there, and then again the questioning, what's going on.
We'll tell the patient that if you are suspicious of disc problem, we'll tell them that probably you might not be as responsive to the treatment versus a muscle spasm on the back.
That's right. Well, I do treat both, but usually after 1 or 2 sessions, if somebody is not getting better, then I'll have them call their doctor for an MRI if I really feel that there's.
Combined with traditional medicine at that.
Absolutely.
Laura, thank you very much for coming and enlightening us about
acupuncture. Thank you so
much. Now it's time for this week's article. It is dietary cholesterol and egg intake and risk of dementia. The prevalence of dementia is expected to be tripled by year 2050. The evidence about the association between dietary cholesterol intake and risk of dementia is controversial, and there's a little information about the association of cholesterol and egg intake with the risk of cognitive decline in general population. Eggs has traditionally been stigmatized because of its high cholesterol content, but recent studies have challenged the role of dietary cholesterol or egg intake in disease etiology. Eggs are a source of many nutrients and bioactive compounds than just cholesterol. Eggs contain high-quality proteins, unsaturated fatty acids, many necessary vitamins and minerals, including bioactive compounds such as lutein, zeaxanthin, which are important for prevention of age-related macular degeneration. Recently, researchers from Finland investigated the association of cholesterol and egg intakes with incidence of dementia, Alzheimer's disease, and cognitive performance in middle-aged and older men in Finland. 2,500 dementia-free men aged 40 to 60 years were included in the study. During 22-year follow-up, 600 men were diagnosed with dementia and Alzheimer's disease. Neither cholesterol nor egg intake was associated with increased risk of dementia or Alzheimer's disease. Instead, higher intake of eggs was associated with better performance of cognitive tests that assessed executive functioning. In conclusion, there were no indications of relation of dietary cholesterol intake or moderate egg consumption with an increased risk of dementia in this study. Instead, egg consumption had positive association with cognitive performance. So include eggs in your diet. Good health is precious and priceless. For up-to-date medical information, visit AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.